Feline tooth resorption is a very common occurrence. Some studies have shown that up to 60% of cats over 6 years of age have at least one, and those that have one typically have more. Your veterinarian may also have called them an odontoclastic resorptive lesion, a cat cavity, or a neck lesion. All of these are the same lesion. This is a classic example of tooth resorption in the lower third premolar of a cat. This little red area is an indication that your cat has tooth resorption. These lesions are excruciatingly painful in cats. No matter what your cat's behavior may tell you, they are painful and in need of therapy. This is a diagram of the lower third premolar in a cat. It has two roots. Here's the gum line, and here's the crown of the tooth. We do not completely understand this disease process, but what we do know is it is caused by a cell called an odontoclast. Odontoclasts are a cell which resides in the bone and the tooth of all cats, and they are responsible for the normal remodeling of tooth structure. For some reason, these odontoclasts get turned on and they start eating the tooth. And they eat and eat and eat, destroying a lot of the tooth surface. Eventually, this will extend up into the crown of the tooth. And it will create a defect, usually right above the gum line. Typically, the gingiva will grow up into this defect, and so what you will see is rather than a hole, you'll see an area of inflamed gingiva in the site. This is your indication that there is a resorptive lesion underneath, and again the picture will look like this. Note, however, that inflammation need not be present to be indicative of tooth resorption. In this photo, there's very little inflammation, just a little bit of gingival hyperplasia in the area. However, the dental radiograph revealed significant resorption to the tooth. There are currently recognized two types of tooth resorption, type 1 and type 2. This is a diagram of your cat's lower third premolar again. Here's the gum line, here's the tooth, the roots are down here, and this is the root canal. In type 1 tooth resorption, what occurs is that the tooth will be eaten away by the odontoclasts, however, it will leave the root canal and the periodontal ligament intact. If the root canal and periodontal ligament is intact, the tooth must be completely extracted to cure the problem. Here is a dental radiograph of the lower jaw of a cat with type 1 tooth resorption. The defects in the crown are shown by the red arrows. However, the root canals are normal, as demonstrated by the yellow arrow, and the periodontal ligament is normal, as shown by the blue arrow. Complete extraction is necessary in this case. If these roots are left behind, pain and infection will invariably continue. Here is a dental radiograph of a patient who had a lower first molar inappropriately treated with crown amputation 4 months ago. The pet was still very painful and had a swelling in the area. The dental radiograph reveals that this is a type 1 lesion with normal periodontal ligaments. In addition, there is periodontal infection, as shown by the blue arrow, and root canal infection, as shown by the red arrow. Extraction resolved both the pain and infection. In type 2 resorption, what will happen is that the tooth will be replaced by bone moving in. This is known as replacement resorption. In many cases, the entire root is eaten away and replaced by bone, making extraction exceedingly difficult. This is a radiographic example of an advanced type 2 lesion. Extraction of this tooth is difficult to impossible. Therefore, it is an excellent candidate for crown amputation. To perform a crown amputation, the first step is to raise a very small gingival flap. After it is exposed, the tooth is cut off flush with the bone and smoothed. Finally, a few stitches are placed over the crown amputation site. As you can see, this is much less invasive than a surgical extraction. However, it can only be used on confirmed type 2 lesions with extensive root resorption. Here is an example of a tooth which has been incorrectly treated with crown amputation. There is still a piece of tooth sticking out into the mouth, creating pain and infection. The probe is going into the defect created by the root. This is the radiograph of the previous case. Note that the periodontal ligament, which is shown by the red arrows, is completely normal. This tooth should have been completely extracted. Furthermore, notice that there is a sharp piece of tooth remaining above the bone, which is very painful. This is shown by the white arrow. As you can see, feline tooth resorption is a very common and very painful condition for cats. Proper diagnosis and therapy requires dental radiography. Ask your veterinarian for full mouth radiographs every time your cat has a cleaning.